Welcome to True Health Tuesdays. Today we're talking about hormones, but hormones are really, it's a subject that we really don't know how they work. Okay, and I'm talking the endocrinologist. We know that one hormone affects other cells, and they can affect neuronal activity and physiology in every way that you possibly can. And this is how your body functions. But what's interesting, they don't actually know the mechanism of how each hormone works. And I know you think that well, that doesn't make sense. So we're only going to study about stress hormones and growth hormones, because your body can only do two physiologies. It can either grow and repair or go into fight or flight mode, stress mode. And if you know that there's an actual really cool balance with this, when you hear terms like hormones and neurotransmitters, what a neurotransmitter is, it's a chemical released by nerve cells to send signal to other nerve cells. So it's how the brain and organ systems communicate. Now we're only going to go over cortisol and adrenaline. Now adrenaline is also called adrenaline's the traditional term. Epinephrine is now the new term that's kind of more accepted. Noradrenaline is a derivative of adrenaline or epinephrine. So you're going to see adrenaline and epinephrine used interchangeably. Okay, so don't let that confuse you in the literature. And noradrenaline or norepinephrine is also the similar structure. It's just produced in it has a methyl group on it. That's the only difference. So when I say adrenaline, I'm talking about everything, any kind of stimulant. When we talk about cortisol, we're talking about the effects of what cortisol does. But both of those are stimulated under normal stress response. Now, is stress good, bad, or vital? Vital. It's vital. If we don't have appropriate stressors in our life, we die. Okay, so don't look at growth and repair as good, because if you're looking that the body is always in a state of harmony and joy and growth, you're living a delusion. Okay, we have to have stressors and we have to have growth and repair. So anybody that's going for peace and harmony, it's not going to happen. When we're looking at dopamine and serotonin, these are the two that we're going to, now there's hundreds of different hormones, but we're only going to look at these four. Okay, does that make sense? So we're going to simplify it. Now this is a story that this is a typical patient. Okay, and I want you to think about the hormone effect and the therapies that are done to her in this day and age, because this is, it's really a sick, insane medical system that is second-guessing the body's physiology. Now, 65-year-old gal comes in, she has a lot of problems with her knee, can't walk. Now, it turns out 20 years ago, her doctor prescribed high cholesterol, or a drug for high cholesterol. The side effect was that it started to swell her joints. Now, you're going to find out what's the function of cholesterol. You're going to find out, now think of this, 20 years ago, she was 45 years old. So is she going through a hormonal change? Possibly. Possibly not. It depends on her estrogen exposure and physiology. She may be going through the hormonal change or menopause. But they prescribed her a cholesterol-lowering drug. So her body developed at 45 years old high cholesterol for some reason. And then let's just follow this sick scenario. And since her joints were swollen, the doctor took her off of that drug. And what do you do when you take off one drug? Survey says, give her another. Yeah, baby. Okay, good. So they gave her another drug, and then her knee swelled up, and she stopped the drug because she couldn't walk, but the swelling kept going on. So then they think, oh my gosh, with the pain, if I'm standing on your foot, what's your physiology? What's going to happen? Your blood pressure is going to do what? It's going to go up, because under physical, chemical, or emotional stress or pain, blood pressure is going to go up. Now, in a normal healthcare system, they would say, wow, this joint pain and swelling is going to make your body respond correctly by giving you high blood pressure. In the crazy world, we're going to give you a drug to lower it. So they gave her Diovan. And now the rheumatologist looked at the knee swelling and said, wow, let's just draw the fluid out. It's probably just some type of weird arthritis. So then he shot her knee with cortisone. Now, if you look at it, cortisone is similar to cortisol, where it's a steroid, but it's going to shrink the swelling of the tissue chemically. And they actually have a warning that if you use more than 4 shots of cortisone, that it actually destroys the joint cartilage. Now, I don't know if am I the only one that thinks it's stupid to have a swollen, damaged joint, and you inject something to make a person temporarily comfortable while the joint destroys faster? Okay, maybe my mom gave me too much common sense. It's entirely my fault. So now, here she goes. Now, with pain, you're giving pain relievers. Now, the pain relievers, typically Motrin, Advil, Aleve, ibuprofen, all of those are non-steroidal anti-inflammatories, and they do weaken the immune system. Now, weaken her immune system, she got a foot infection, more than likely in the same leg, because knowing that you have a pump in the calf and you're walking with a limp now, the calf isn't working correctly, so that means it's going to decrease blood flow. If you have an infection, do they do a culture and a sensitivity test, or do they give an antibiotic and another pain reliever? Yeah, why not a steroid too? Because we're going to weaken the immune system and give her an antibiotic. Well, that damages her liver, okay, causes hepatitis, and then they think, well, let's give her some steroids because this must be an autoimmune condition. Have you ever heard of this scenario before? Everybody has. Everybody has. Now, in my field, I get this all the time. And people are coming in, oh man, I got this fibromyalgia, I got this sciatica, I got this peripheral neuralgia, I got this high blood pressure, I got this. They don't have it. It's the body is actually adapting to deficiency and toxicity. I mean, within just a few weeks, she was pain-free. She came in, we got her nervous system working right. So how do we regulate her hormones? How do we get her body to regenerate? We got her body to just function correctly. I mean, it really is that simple. Arthritis is reversible. So now when we're talking about hormones, I want you to equate this with the nervous system, because your body is going to produce the appropriate hormones given the right stimulus. Now, you got two halves of the automatic or autonomic nervous system. One part, and it's going to correlate it because we're looking at stress hormones, and that's the sympathetic nervous system. It's more active during the day, and it's more involved in stressors. And if you look at it, the sympathetic nervous system, it even says secretion of adrenaline and noradrenaline. Wow, so if you stimulate this nervous system, it stimulates the stress hormones. That makes sense. Well, the parasympathetic is also the rest, digest, and repair mode. So we have to have that balance of the nervous systems in order to regenerate tissue. We do need the stress. Now, if you look at Gray's Anatomy, it controls and coordinates every function of the body. So if you take anything that damages or alters the nervous system, you're damaging every function of the body. And that's the key. That's why in pharmacy they're going nuts to try and find drugs that affect the nervous system. Okay, this is like primary, this is like the big money maker. If you can get something that's going to affect the nervous system, man, you're making bucks forever. Now, what's interesting is chiropractic care can alter the nervous system. We can alter it, the autonomics, from the sympathetics to the parasympathetics to the appropriate response. See, I learned this in chiropractic college, I think in the fourth trimester, like the first 2 years. And I'm going, oh my gosh, you mean we can change the autonomics? Now, even if as a young student, I'm thinking, my God, that means diabetes, high blood pressure, depression, anxiety, serotonin production is going to go up. We can solve inflammation. Are you sure? Does everybody know this? Why aren't we on the Channel 7 news? This is incredible. Okay, really, it blew me away. So when you look at cholesterol, and just think of that first story, okay? Her cholesterol was elevated. Well, really, what's the function of cholesterol? I got a patient in from Hawaii, and he'd been taking cholesterol drugs for 20 years, and his joints were starting to break down. And I said, well, no kidding, you're taking cholesterol drugs for 20 years. What's the function of cholesterol? And I asked him, and he looked at me and said, clog arteries? And I said, you're right, your body's ridiculously stupid, you're producing something. No, cholesterol doesn't clog arteries, okay? It's actually the precursor to every hormone you make. So when we talk about hormones, and here's how it all lays out. But cholesterol will turn into cortisol, cholesterol will turn into testosterone, cholesterol will turn into estrogens, cholesterol will turn into progesterones. In fact, cholesterol will turn into every glucocorticosteroid, minocorticosteroid, sex hormone. I mean, virtually everything. It's the building product of most of the hormones in your body. and it's produced and stored in the liver. I've got a patient who's a pediatrician, and he works only on neurologic damaged kids. He doesn't vaccinate anymore, obviously, and he gives to some of his patients cholesterol supplements. Think of this, because if you've got, and this is on autistic kids, encephalitis kids, and we've got a ton of those vaccine damaged kids, but what is that? That's brain swelling, that's inflammation. So is your gut body going to require more cortisol, which is an anti-inflammatory, so it's going to need more cholesterol? Wow, isn't that cool? I know, it actually makes sense. Here's a patient that came in. I changed the name, but she came in from Florida yesterday. And this is the typical patient. Now, this is her entrance form. You check off everywhere you're hurting. Isn't that amazing? And I'm going, hon, you missed a couple boxes. you know, and it's just like, my God. And we shouldn't be this way. Think of this. And this was from an injury in 1993. That means she's been hurting for over 20 years. And in this culture, what is she getting? Medication, therapy, everything else. I mean, she's trying to do it naturally. But again, what are they giving her? For pain, they're giving her pain relievers. For swelling, they're giving her anti-swelling drugs, you know, anti-inflammatories. It's just crazy. But when you look at this is her gut, and you're looking at all that black stuff out there, that's an abnormal bowel gas pattern. That means either the drugs or the food or the nerve supply to the gut has been altered, causing the intestinal tract to expand out and look completely abnormally on an x-ray. And this is also what leaky gut looks like. Now, knowing that one of those hormones that we're talking about, the serotonin, is produced in the gut. Now, it's interesting. She says, no, I don't have any gut problems. I just got joint swelling everywhere and my hands are starting to shake. Hun, you got a gut problem. You know, so you look at this, and she's also got massive pressure on the upper cervical. So she gives us 2 days she was here, okay, to get her better. And we filmed the adjustment. Hopefully we can find someone in Florida, because that's, in my world, it's close. It's only like 3,000 miles away. She thinks it's far. Okay. Sorry, that was like a joke. No, but what happens is, you know, we film the adjustments, and maybe she'll get care back there that we can, you know, be appropriate. But this has to be corrected. What's a trip is all the therapy that she's gotten for the last 20 years are for symptoms. Nothing's respecting the body, respecting the hormones that it's producing, respecting the inflammatory processes, and solving it. Does that make sense? So we got to start respecting humans now. Now, some of the other things that we're being exposed to, okay, and this is what's causing massive hormonal imbalances in our society. Imagine if I put a chemical sweetener called aspartame or NutraSweet, and I said it's okay unless you heat this stuff up to 86 degrees. If you heat aspartame up to beyond 86 degrees, it breaks down into formaldehyde, which is cancer-causing wood alcohol. It's completely neurotoxic. Then Russell Blaylock actually wrote a book, Aspartame, the Sweet Taste That Kills, or the neurotoxin that kills. So it's deadly. But we know that even the side effects includes seizures and death. So if you're taking diet products, you have to stop. Okay, it's not like, well, okay, I'll keep taking it until I develop symptoms. Okay, does that make sense? I did have a picture of, I was telling some patients earlier, I did a talk like this and I had some dinosaurs up there. So if you wait till it's too late, it's probably too late. Or wait till there's a problem, you know what I mean? Splenda. Now, it tastes like sugar because it's made from sugar. Okay, isn't that good? Doesn't it make you want to buy it? It's real sugar. And now think of the advertisements, because as you take it, it tastes just like sugar. Your body recognizes that there's a poisonous chlorine molecule added onto it, and so it gets it the hell out of there so you don't absorb it. The problem is it has to go through the digestive tract, which is loaded with acids, and it typically breaks off some of the chlorine molecules, okay? Now, chlorine, as you know, is a neurotoxin, and it's actually poisonous to the system. It does cause cancer. Now, cancer typically takes decades to form if you're slowly poisoning yourself. But when it comes to hormones, The thymus and spleen. The spleen is a blood filter. It's part of the lymph system. Enlarged liver and kidneys. Now, why would a kidney have to start to grow larger? What do the kidneys do? I get confused. Oh, kidneys are a filter. Oh, so if your blood's more poisonous, the kidneys have to work harder. Oh, I get it now. Okay, so on top of the kidneys is an adrenal gland. That's the pharmacy of the body. That's what's on top of the kidneys. So that starts to get, and then it's also reduces growth weight in adults. Have you heard of human growth hormone, HGH? Okay, I mean, it's what everybody's doing to keep young and healthy and everything else. Well, it reduces that. Hormone replacement therapy. This was a biggest scam through the 70s. It's something that young women have, old women don't. Beautiful, let's inject older women. Oh, bummer, whoops, 30 years later we find out it causes cancer. So this is the Journal of the Cancer Institute. The conclusion is evident that postmenopausal hormones cause breast cancer. So this means the hormones that they prescribed, and I actually got a patient in last week who had her, she was 65, she had her ovaries and uterus taken out in, I think it was 20 years ago, so like the late 80s, early 90s. And I said, well, why? What was it? Was it fibroids? Was it bleeding? She said, no, I had a prolapsed bladder, and I thought, you know, since you're in there fixing it, take out anything that's going to possibly give me a problem. So they took out the ovaries, the uterus, the appendix, and the gallbladder. And I'm going, what? You're kidding. I mean, and this girl told me, I don't think she was stoned. Okay. But what was going on in the 80s? You know, what kind of drugs were they doing? Because this was just, I mean, I didn't know. I'm not speechless usually, but I got to tell you, it was like, what? If the gallbladder's removed, you can't absorb fats healthy, so that means your risk of cancer increases. If your appendix has been removed, you have a 60% increased risk in colon cancer. If you have the ovaries and uterus removed, you're going to have a massive adrenal fatigue state. I mean, this is like, you know, you're 65 and you're going to be dead at 70. You know, that's just insane. More hormone. Estrogen is a cancer. Now, this isn't the only estrogen that you take. It's the estrogen that you're exposed to. And this is at a Northwestern University, you know, endometrial breast cancers. But why are we exposed to so many estrogens now? And again, this is one of the hormones. And now what's interesting, this is also, estrogens are balanced out by progesterone. And progesterone is produced by the adrenals. So now think of this. If you're exposed to plastics, okay, you're getting xenoestrogens. Does that mean your adrenals have to work harder to produce the progesterone to protect you? Yes or yes? Yes. Okay, so if the adrenals are already taxed by taking, you know, a synthetic sweetener or Advil or a Motrin or a Aleve, or an aspirin, all which damage the kidneys, can you see there's going to be further damage faster? Yeah? So also, excess estrogens. If you're living in a community or a society that has food that you can't process or digest, the body's so efficient, it's going to start to store it. And fat becomes its own estrogen-producing organ. So all of this stuff has to be changed in order to fix problems. Now, let's say that you have a kid with brain swelling. Okay, it's called encephalitis. Let's say you have a kid with mild brain swelling. Okay, and he's going to have like some sinus issues or a chronic headache. What's he going to be diagnosed with? Attention deficit disorder. This is why we're seeing about 25% of the kids with some type of inflammatory condition now. We're talking 1 in 2 of a chronic disease. So typically when they go to the pediatrician's office, they're going to give them kiddie cocaine. It's actually called Ritalin. It's the #1 drug traded on college campuses. But look at what it does. Depression, insomnia, nervousness, rash, abdominal pain, where's serotonin produced? The stomach area. And you look at this, it's just like, my God, they're getting a stimulant and it shouldn't be there. So now let's look into, because we're looking at the things that negatively affect hormones. Now we're going to look into just those 4 hormones, where they are. So we can have an appropriate stress response and an appropriate feel-good response. Serotonin, 90% of it's produced in the gut. So if you have mood problems, memory issues, ability to learn, arousal, aggression, impulse control, sleep, heart palpitations, all of these things. Should we first look to where 90% of that hormone's produced? Yes or yes? I know, it just makes sense. The problem in our society nowadays, if you have cardiac arrhythmias, they're going to go in and burn part of your heart. Okay, or stop it and try and start it again. They're not going to look at the gut function because the cardiologist doesn't understand that serotonin is produced in the gut. Okay, does that make sense? They don't know that the excess estrogens could be causing an inflammatory response, which could be reducing serotonin. Okay, because those hormones, they counterbalance each other. If you got high stress hormones, you're going to have low growth and repair hormones. If you have high growth and repair hormones, you're going to have low stress hormones. So if your body has a lot of inflammatory responses or damage, you're going to have low serotonin production. Does that make sense? So this is why it's more important than anything. Dopamine. Now, this is vital because movement increases dopamine. What happens with low dopamine? Have you ever seen a Parkinson's patient? Yeah, movement increases dopamine. Dopamine's a feel-good hormone. So is there a reason that in between the adjustments, because sometimes we'll do multiple adjustments a day, that we say, look, go walk, okay, go move. Why? Because that's going to stimulate dopamine production. It's also going to change proprioceptive responses. It's going to actually change how the nerves fire off, and it's going to correct scoliosis and abnormal damage quicker. Does that make sense? Because I mean, if just walking and movement can change hormone production, isn't that cool? I know. So does that also mean not movement increases problems? Is this why there's an excess Alzheimer's, excess Parkinson's in our... See, there's a term in sailing called reefing the sails. When your boat's heeling over, okay, it's 35 knots of wind, the boat's at about 35-degree angles, which is very, very scary. You're supposed to reef the sails, but you can't because there's too much wind. So you know what you do? You just scream and say, please God, help me. Okay, you might, depending on the waves, you might be able to pull into the wind and reef the sails, but it's just hellaciously scary. So the term is, when you feel that you have to reef the sails, it's already too late. Okay? So when you start to notice the tremors, the essential tremors, that could be low dopamine or some type of neurologic problem, okay? Could that be from sedentary lifestyles? Absolutely. So it's not too late with that. It is too late in 35 knots of wind, but it's not too late. It's not too late in this case because dopamine levels can be. And all you got to do is do little bits of movement and your body's going to increase that production. And look at this, it vasodilates, it opens up blood vessels. So what if you open up the blood vessels? What does that do? That lowers blood pressure. So does that mean people with high blood pressure perhaps have some type of stressors on there? Schizophrenia, hyperactivity disorder, restless leg syndrome, all low dopamine. Does that make sense that restless leg syndrome, because movement stimulates dopamine? My God, the body's smart. Jesus. Okay, adrenaline. Okay, you know, and again, this is also epinephrine. Similar structures as norepinephrine, noradrenaline. Okay, they're all the same thing. But when we look at this, increased heart rate, increased respiratory rate. Now, it does both constriction of the blood vessels and dilation. Why would it do that? Because when you're running away from a tiger, you want less blood going to some areas, more blood going to others. Does that make sense? This is what does it. Now, if you're in chronic stress and you're not actually running away from a tiger, long-term stress can cause damage. Now, well, when we look at this, it stimulates glycogenolysis. So this actually breaks down glycogen and glucose so your body can use it, so it elevates blood sugar. Imagine if you had blood vessel constriction and dilation simulating that you have high blood pressure and elevations in blood sugar because of a chronic adrenaline or chronic stress state. What would you be misdiagnosed with? High blood pressure, high blood sugar. Yeah? I know nobody is like that in this room, so don't worry. Okay, and this is cool because when you're talking about, have you ever heard of asthma? Okay, we got tons of kids in here, tons of adults with asthma. And this is kind of neat because exercise increases adrenaline, obviously, because you're working and it's a stress hormone, you're putting your body physically under stress. Well, bronchoconstriction is reversed by adrenaline. Why would that be? So think of that. If you have constriction of the bronchioles, that's called asthma. You can breathe air in, but you can't breathe it out. Think of that. I mean, it'd be like you're drowning in your own air. Okay, now adrenaline actually opens it up. This is also why a lot of athletes have asthma, because you can legally do a steroid, which opens up the blood vessels. Okay, man, let's go running. Okay, no, think of that. So it's a legal drug that you can use in some sporting events. But what does that bronchodilator do? It stimulates the sympathetics, so it enhances performance. But now, wouldn't it be neat if you had exercise-induced asthma, that instead of calling it exercise-induced asthma, where's adrenaline produced? Say the adrenal glands. You're so right. So that means if somebody has exercise-induced asthma, it's not a problem of the lungs, it's a problem of adrenal fatigue or insufficiency, or maybe even it's a liver problem that they can't produce cholesterol to make the adrenaline in the first place. Oh my gosh, that is so cool. I know, isn't it neat that it's like all connected? Okay, then we look at memory. Enhances long-term memory. Now, do you see the splinter sticking out? Okay, has anybody, or am I the only one, when you were a kid, you were whittling towards you? Ow! Okay, I'm the only one. Okay, well, if you were, that memory would be embedded in your soul. Okay, I'm telling you. Okay, adrenaline actually does that. Okay, but it's also can damage the brain, where the brain is going to not forget this stuff, like in post-traumatic stress disorder. So when we look at this, the normal natural physiological response of adrenaline affecting memory is designed for protective, but if it's there for long term, it could be pathological. So we can actually rewire the brain and fix PTSD. Cortisol, short-term, long-term, all the stress hormones, when they're used for short-term, are amazing. They keep us alive. If it's long-term, it kills you. Short-term, you're talking regulate blood sugar levels, fat, protein, carbohydrate metabolism, has anti-inflammatory actions. Wait, cortisol has anti-inflammatory actions. I'm not saying that as a society we're doing anything that would cause inflammation, like maybe doing a vaccine. Okay, does a vaccine cause an inflammatory response? It does. It stimulates what's called a Th2 response, or an inflammatory response. Do the fast foods that we take into our body, and genetically modified foods, do those cause inflammatory responses in the gut, in the lungs, in the digestive tract, in the brain if it gets into the intestinal tract? Do those cause inflammation? What about antibiotics? Can those cause leaky gut and cause systemic inflammatory response? Holy moly, if we were exposed to vaccines, fast food, packaged food, synthetic oils that can cause free radical formation, which is inflammation. Okay, so this means every toxic oil, every toxic chemical, every toxic sweetener is going to cause an inflammatory response. Yes or yes? Yes. By God, the body's going to be making cortisol. Okay, cortisol is the best anti-inflammatory known to mankind. No, you're supposed to say, yeah, because it's so cool. But the body's also going to need a bunch of cholesterol produced by the liver. So in this society, if you're going to the medical profession, which I don't recommend, they should only be utilized for emergencies, not for healthcare, and you're getting your cholesterol levels checked, and they say high, start thinking inflammatory response and adrenal fatigue. Does that make more sense? Because you don't want to decrease your body's ability to adapt to that stress. You want to maintain a healthy response. Okay, it just makes a lot more sense. Now, it's interesting, they use this man's picture has excess cortisol. But if you're looking close at his chest area to see the carving up there, that's an open heart surgery. Okay, so he not only had inflammation, or because he had to have systemic inflammation, probably even the inflammation of the lining of the arteries, appearing that the arteries were smaller, even though the arteries, generally, they can clean up within 90 days or less. but they actually talk this guy into opening his chest, taking a vein out of his leg, sewing it in the heart, go around an artery that they think is clogged, even though there's always collateral circulation in the heart, and then they sewed his chest back up and woke him up. Okay, so the solution, if you have chronic stress, there is solutions. And what's neat is, one, handle the stress correctly. And handling the stress correctly is really, really simple. Walking barefoot in the grass, dirt, or sand. I know it's tough in Canada, okay, but you can get a grounding pad that you can sleep on. Okay, you can sit there and pick up marbles with your toes. They actually now have grounding sheets that office workers could have, so you can kick off your shoes and you just have your bare feet on the sheet in your office. So, you know, Heidi, if I'm barefoot in the office, don't worry. So I mean, there's a lot of ways around it. Vitamin C, vitamin B3, E, beta carotene. One of the things that we tell people that are toxic is to do carrot and apple juice. Why? Because the beta carotene turns into vitamin A. It's phenomenal. It detoxes the lungs and helps the system. Selenium, minerals. I mean, incredible, because it protects the body from free radical formation. Now the adrenals. Now the adrenals, the renal is the kidney, adrenal means on top of, okay, and if you're going to have a pharmacy of the body, you're going to put it where all the blood flows through. Okay, it's just efficient design. So you got this kidney filter and the adrenal gland on top, and it does produce every hormone, every glucocorticosteroid, mineralocorticosteroid, and sex hormone. So if somebody says they have low testosterone syndrome, when I think of that, you know what I think of? Adrenal fatigue. Some type of liver toxicity, adrenal fatigue, or some type of chronic stress state. Because if you're running away from a tiger, you're not thinking about reproducing, okay? It's true. It's true. You know, how many people have gone home, you know, and all keyed up and say, yeah, baby, I'm ready to cuddle? No, it doesn't work that way, okay? So, well, when you look at it, what kind of things cause inflammation? Okay, alcohol, drugs, food, environment, stress. So food, if you're going to choose food, don't choose chemicals. Okay, it's going to be really simple. You'll save your adrenals. And the adrenals produce estrogen, progesterone. Progesterone protects you from cancer. The more you have adrenal fatigue, the higher your incidence of cancer. Now, do you want to wait before you have a stroke to change your diet and clean your arteries? Okay, you mean having a stroke is just about too late, right? Yep. Okay, good, just checking. Okay, produces interferon. I mean, the adrenals produce over $40,000 worth every day of interferon. No, you can't bottle it and sell it. Okay, so when you look at this, it's essential. Now, how does your nervous system communicate to produce hormones? It pretty much does it through the hypothalamus, okay? There's a lot of different sensors, but there's actually an adrenal pituitary thyroid axis that the hypothalamus actually has sensors through the nervous system. That's why when we're checking hormone imbalances, we don't send you to an endocrinologist because they don't understand the nervous system. We're going to check the nervous system first, find the physical, chemical, or emotional stressors, correct those, and then the body regulates everything else. I mean, it seems too simple. This one, and everybody is going towards this, the entire real scientific world. This is why, I mean, there's an Obamacare sign-up facility out here, okay, and you can tell it's empty all day long, because people are understanding that to sign up for a dysfunctional system, they're trying to get young people to pay for the sick old people that are draining the system. That's not effective. This one here, endogenous pharmacotherapy. This is what the real science is. It means your body produces all the pharmaceuticals that you need, and the right doses at the right time in a non-toxic form. I mean, it's amazing. Brain plasticity refers to a remarkable property of cerebral neurons to change their structure and function in response to experience. That means that we can change your brain function through movement and appropriate stimulation to change the hormone production and how your body responds to the environment. Is that cool? That's what doctors of the future are going to be talking about, not just drugging you. You have this balance between inflammatory and stress. So anything, and from now on, If you go out and you're going to smoke cigarettes, smoke organic American Spirit, and then by God, do a fruit smoothie afterwards. Okay? I know it sounds crazy, but it'll be okay if you balance that. If you're gonna smoke a toxic chemical-laden cigarette, there's not a lot of options for you. Okay, if you're gonna eat a fast food burger, okay, make sure it's only once a month, and make sure that you've got a ton of absorbing antioxidants afterwards. Because what a lot of people will say is, no man, I'm not going to change my lifestyle, I'm a meat and potatoes guy. And I said, well, okay, you can do it, do the meat and potatoes once a week, and then when you do the potatoes, they're going to be organic potatoes, and you're going to mix coconut oil in with them, and you're going to have garlic, which is an antimicrobial. You're going to have some jalapenos in there, which are vasodilators. Then you're going to have some sauteed greens with coconut oil in there, and the sauteed greens are actually going to be phenomenal because they're going to be kale and spinach, going to be loaded with iron, and then you're going to have a big old huge mug of carrot and apple juice, which turns into beta carotene, which is going to clean the lugs and is going to clean the arteries too. And he says, okay, because you don't want to take stuff away to change the lifestyle, you want to add it. So it's actually possible to have an inflammatory lifestyle and still cheat occasionally, okay? Yeah, no one's a saint. I mean, this gal here, if you think about this, they were telling her that it's like in your head. We're talking muscle relaxant, we're talking epidurals. I mean, and she's got no curve in the neck, she's got massive subluxations in the neck. Diseases don't really exist. Pain is a clue that there's a problem, okay? And if you cover it up with a medication, that's foolishness, okay? And any doctor seeing this, because I just actually responded to a comment by one doctor and I verbally beat him up online, and I actually feel kind of good about it, because he's saying, that as a chiropractor, we should be referring people to a healthcare profession has its place in society. Well, let me tell you, if you're given a drug to cover up pain without going after the solution, you're an idiot. You're not a real doctor. Okay, if you're given a shot of cortisone in a joint, unless that person's 110, you're eventually going to destroy the joint. If you're giving that person a cholesterol drug without understanding that they're in adrenal fatigue, you're a bad doctor. Okay? I think he'll accept the letter. I mean, when you look at this, higher blood pressure, lower death rates. Why would that be? 48,000 people in this study. Why would people with higher blood pressure, let's say that you have a toxic lifestyle, let's say the blood isn't healthy, let's say that you don't have enough soluble fiber and those blood cells are getting clumpy and the blood's not efficient. Aren't you going to need higher blood pressure to get the same oxygen transfer? Yes or yes? Yeah. You are. It's arrogance for a doctor to say, by God, I don't care if you have a healthy lifestyle, take this drug to lower it and you're going to be healthier. They don't say that. They say, take this drug and you're going to have lower blood pressure. You're going to die earlier, but at least you'll have lower blood pressure. Here's an inflammatory process called aluminum hydroxide. It's in almost every vaccine. I actually think it's in every vaccine, but it's insidiously unsafe. But look at this. Look at what every vaccine does. Every vaccine has this. Cognitive deficits with long-term encephalopathies. Encephalitis, okay, this is inflammation. That means every time you get a vaccine, a flu shot, an MMR, a DPT, a tetanus booster, every time you get something like that, you're causing an inflammatory response that can actually inflame the meninges. What does inflammation do? It's going to stimulate cortisol, yes or yes? Cortisol is going to actually slow down the serotonin and dopamine. So does that mean every time you get a shot, it can have a neurotoxic effect? Can you see this? It's like we got to like stand on the building tops and get a cardboard sign like this guy in the corner. Okay, vaccines and neurodegeneration. Russell Blaylock, brilliant guy. But what does he put on there? Brain inflammation, monosodium glutamate, artificial sweeteners. Okay, if you're taking monosodium glutamate, and there actually is an Asian market down there that has a big bag of MSG on it. Honest to good. Okay, those type of neurotoxins don't. Like when you're getting your coffee, do you want the pink stuff, the blue stuff, or the organic sugar? Get the organic sugar or stevia or honey. Dear? Oh. Okay, and exercise. Remember, movement stimulates dopamine production, right? This is where restless legs, this is where, you know, the Parkinsonian's tremor come from. And it doesn't have to be much, a half hour a day, you know, half hour a day working, walking. If you want to just like go crazy and you're going for a 10-minute walk, try having a can of food in each hand. You take about 1,000 steps in 10 minutes. If you have a pound can in each hand, you're lifting 1,000 pounds. Isn't that cool? You're burning calories lifting 1,000 pounds. You do 5 pounds per arm, oh my gosh, you'll be blown away. This is actually the solution. It seems too simple when we talk about you got to drink more healthy water, no fluoride in it, no chlorine, eat more organic vegetables, reduce or eliminate the drugs, eliminate refined foods and rich foods, environmental toxins, and deal with the stress effectively. It seems too simple. But the solution is, the tough part is any of this stuff that restores your hormone balance naturally billable in the medical world? No, and that's something we got to change. That's why those poor bastards at the Obamacare thing they're not signing up people. Wait, I didn't just say poor bastards, did I? Okay, good. I was hoping, because there's a filtering, guys, from the brain to the mouth. Sometimes it's like turned off. Okay, good. And the stuff that we got to avoid, high fructose corn syrup, of course we're going to avoid that. Standard American diet, medication, refined fooders, enriched, environmental toxins, unhealthy stress. I mean, it just makes sense. This is what you need to do, okay, to keep healthy. You need appropriate nerve supply, exercise. Does exercise stimulate dopamine production? Yes or yes? It does. Healthy nutrition. Does that have healthy gut function and healthy serotonin production? Absolutely. Sufficient rest, prayer, meditation. And our cruise is coming up. February 21st to the 28th. If anyone has ever been to the Caribbean, I'm telling you, the water is bluer than this man's shirt. It's so blue it hurts your eyes. It's beautiful. Okay, and then we're going to have 16 hours of teaching. We've got 3 speakers lined up. I'm trying to get a 4th lined up, and we're just going to have a ball. When we're at sea, we're going to be learning how the body works and to restore health. When we're on land, we're going to be swimming with the turtles or going to Jamaica, man. Okay, you know, getting some jerk chicken, you know, or whatever comes in those little tubes that they roll. Okay, and then at nighttime, we're going to be on the boat, okay, and we're just hanging out. It's just like really fun. Okay, so go to the cruise. It's owners-guide.com/cruise 2016, and I think there's a few cabins left. But thank you very much.